I really didn't envision this creatine situation taking 3 videos, but alas, here we are with our final video to discuss myths associated with creatine. So the first myth is that creatine causes kidney damage. Now, the reason that this myth started is that doctors will measure something called your creatinine in your urine, and that is an indicator of kidney function. Not to get too biochemical, but basically creatinine is a breakdown product of creatine. So if you take creatine, you will have increased creatinine in your urine. It is very important that you tell your doctor this so that they don't think you have kidney damage. Now, studies have shown that creatine is healthy in adults up to 20 to 30 grams per day. But if you do have a pre-existing kidney condition, I would discuss this with your healthcare provider. The second myth is that creatine causes dehydration. The opposite is actually true. Creatine can encourage intracellular hydration, but just ensure that you are drinking your normal intake of water. The next myth is that creatine makes people fat. And the reason for this is that when you take creatine, most people do experience an increase of water retention in their muscles. It can be about 3 to 5 pounds. So if you step on the scale, it could be alarming and you think you gained fat, but you really didn't. It's just that intramuscular hydration. So studies have not shown that creatine causes fat gain. And in fact, if you're increasing your lean muscle mass, you're probably overall resulting in decreased fat. Okay, the last one is one that I've seen all over social media, and it is that creatine leads to baldness. Obviously, this would be a huge concern if you were taking creatine. The reason that this started is that there was one study that showed that creatine increased a hormone called DHT, which has been associated with male pattern baldness. There has never been a clinical study showing that creatine causes baldness, and even the DHT finding really wasn't replicated apart from that study. So I would not be concerned about taking a standard dose of creatine and inadvertently causing baldness. Let's do a couple troubleshooting methods too. If you are experiencing gas or bloating from creatine, try breaking your dose into smaller doses that are taken frequently throughout the day. The other thing I would say is that there has been some evidence that taking it an hour before or after exercise can have increased efficacy, so that's something to consider as well. And then I would say the last thing is if you're having a hard time with your creatine dissolving in water, either mix it in yogurt, which is what I usually do, or you can buy the microionized form, which dissolves better. Hope this answers your questions.